this will come as no surprise that the challenges are many and varied. They've always been there. Obviously, COVID is the one that everyone's going to talk about, and we are spending a huge amount of time at Guy's and St Thomas to talk about our COVID recovery plans. And I think what's really struck me and my colleagues over the last few months is this is a long-term recovery. This is not recovery. We're not talking months. We're talking years. And what we are already seeing is an impact of patients presenting with more advanced disease, more higher acuity of symptom burden, and obviously that has a massive impact on workloads. So there's kind of that patient side of it, and also we had a reduction in referrals. We are now seeing referrals go up because we know, very well highlighted, the kind of misdiagnoses. So these patients are surfacing. So higher workloads, we don't have a higher workforce. So we're balancing that with the challenges to workforce. Recruiting to clinical nurse specialists has always been challenging, especially in London. I think in other kind of cities. That there's acknowledgement that a lot of that expertise is patients are either nurses are either retiring or coming to the end of their career, and we're not getting that pipeline of cancer nurse specialists is kind of wanting to come into clinical nurse specialism for a whole myriad of reasons, which I could whitter on to for ages. So I think that's those two challenges. How do we support our cancer nurses to not get burnt out? Just that kind of just keeping on top of that, the daily kind of hamster wheel of operationally trying to deliver what you're trying to do. We're really trying to support them to deliver care in that person-centered way, which can, I think, can sometimes seen as a bit of a luxury. It isn't, because we know when that's done well, there's a feedback loop, and the more we can actually support patients, the less likely they are to bounce back into the system, to need acute intervention. So it is worth that investment, but it can be hard perhaps to see where that's going. So I think, challenges are our workforce, COVID. I think for cities like London, a lot of people, colleagues are readdressing, do they want to keep commuting? Do they want to keep doing all these long hours? We've seen that people moving out of London. So it's a bit of a perfect storm. And I think, there is and also we're moving into winter, there's a certain sense of trepidation and anxiety about exactly what the next sort of year, 18 months, 2 years is going to hold for everybody.